We're going to get started, and I appreciate everybody coming to watch the show, The Art of Mindful Medicine. My name is Dr. Seth Gilson. I'm a biological dentist, yoga teacher, and now here we have Dr. Denise Fournier. Dr. Fournier is a licensed mental health counselor. She has a master's in mental health counseling and a PhD in marriage and family counseling. She is a psychotherapist, coach, facilitator, and adjunct professor at Nova Southeastern University, where I went to school as well. Over the last 15 years, Dr. Fournier has worked in numerous mental health settings, guiding several hundred people on their own unique growth journeys. In addition to her work with clients, she also writes for Psychology Today and facilitates integrative healing events for a diversity of audiences. Her work, as well as her writing, center on the Eastern traditions of Zen Buddhism and Taoism, which encourage a balanced, open, and accepting approach to life. Dr. Fournier has a private practice called Evergreen Therapy in Miami, Florida. So, Dr. Fournier, say hello.
Hello. Thank you so much for having me.
Of course, absolutely. My pleasure.
I'm excited to be here.
Yes, me too. I'm very excited to have you on here. So now that gave a little bit of background, credentials, and all that kind of snazzy stuff. So I always like to start these talks with gratitude. So I'm going to ask you to tell everybody 3 things that you are grateful for today, please.
Beautiful question. I am grateful for health. Mm-hmm. I am grateful for technology, for enabling this, for enabling continue to work and to connect, and I am grateful for this Florida weather, this beautiful day.
Right? Yeah, yesterday was completely raining the entire day, but today it's definitely looking a little bit better.
Yes, see the light again.
Yes, exactly. All right, so let's hear a little bit about you. Tell everybody a little bit about yourself, your personal story, growing up, where you're from, all these types of things.
Sure. So I was born and raised in South Florida, actually. I'm a South Florida native, which is a rarity around these parts.
Ditto, me too.
Yeah?
Yeah.
Ah, good to know.
Absolutely.
There aren't very many of us.
No, there are not.
So I was raised in Miami, born in Miami originally, Hialeah, if you want specific, to 2 Cuban parents. My parents both emigrated from Cuba in the 60s. So first generation born American. We moved to Broward and was raised there, went to private school. And early in my life, I had, as I shared with you, I had a pretty traumatic experience of losing my father very early to cancer. He was 42 when he passed. I was 10. My siblings were 13 and 5. And that event really sort of shaped my upbringing. It really shaped the trajectory of my life and even my choice in profession. So going through that really difficult experience, I got a lot of awareness, perhaps only in hindsight, about the impact of these major events that we go through in our lives and the ways in which we internalize those, and then those sort of become our sort of orienting set of core beliefs and set of experiences that really set the tone for life. And so that was the case for me. Going through that really difficult experience early on. I went on to then leave my home and leave Florida at 17 to go to college. I went to school in North Carolina. And from there had a few really fortuitous experiences that got me very much interested in psychology, really by way of exploring my own personal experience of what was going on with me and my own sort of emotional response to the difficulties that I experienced in childhood. By that point in my life, I had developed a pretty crippling anxiety disorder, which had manifested in a lot of different ways in my life. And I had the great fortune of being introduced to a therapist who helped me tremendously, not only as a therapist, but later on as a mentor and as my first Buddhist teacher. She introduced me to meditation and mindfulness and Buddhist practice.
Great.
And from there, I started to pursue my path, really. And so, of course, many things unfolded both personally and professionally. But that was sort of the origin story of not only how I became who I am, but how I wound up choosing this path for myself.
Very nice. Very nice. So rewinding a little bit back to when you were a child, what are some of the things you liked to do when you were a child? Before you got into all this?
Yeah. Wow, that's not something I think about very often. actually really appreciate that question. I was a really imaginative child, so I like to create. My grandmother always wanted to keep us entertained and away from the screen. We were not a TV family,
Uh-huh.
so we would always put on plays. She would sew costumes for my siblings and I, and we would come
Very
up
cool.
a script and we would do performances and shows. So I was always interested in that. I was a dancer growing up. I danced competitively for about, gosh, maybe 16 years,
Wow.
15, 16 years. So dance was a big part of my life growing up. So I did a lot of things oriented around that, and that
Very
was really
cool.
my passion. And I was also a big reader. I would have taken reading a book over almost anything. And I
Wow.
remember my favorite thing to do as a kid was meet up with my best friend and sit side by side and read two different books. And that was
Awesome.
like bliss for me as a kid.
Nice. Very
It
cool.
still
That's
is.
not something you hear a lot of people that were too fond of when they were young. Not,
It
not,
was,
not me, anyways.
yeah. It was big in our house. It was, my father was, he was a writer and an editor, and he was an avid reader. And so he really encouraged us to read. And in fact, that was how our allowance was based when we were kids. So
Wow.
rather than like doing chores, we got a little bit of allowance on the basis of having learned one new fact every day that we didn't get from school. So we had to, read the encyclopedias or read books and then present what we learned to the family so that everybody could
Nice.
benefit from what we were learning. So it
That's
was very much,
awesome.
yeah, encouraged in my house.
I think I might steal that when the day comes when I'm in that situation. I like that a lot.
You're welcome to, yeah.
um, so I heard you were into dance. What is something that you thought you wanted to be when you were growing up?
I always thought there was a period of time when I thought I would pursue dance professionally. I saw lots of my peers who I was dancing with going on to choose that as their path, and for some time I thought that would be me too. But I was really so academically inclined
Hmm.
that what really compelled me was to be a teacher. Actually, I always felt pretty confident that I would wind up being a teacher, and in fact, I have become one.
Yeah, I was gonna say basically. I mean, you are just not probably not the kind that you were initially thinking.
Exactly, exactly.
Very cool. Um, so I know you started talking about it a little bit. What inspired you to get into the health and wellness industry then?
Really my own pain and
Hmm.
my struggles, to be honest. My own wounds kind of led me to seek out things that would be healing and things that would be soothing. And it sort of happened unconsciously by, finding myself in that position of needing a therapist. I, for the first time, was introduced to this whole wide range of possibilities for being with myself through the difficulties that I was going through, and for accessing resources that were going to help me and support me in the ways that I needed it. And so that sort of planted the seed for being interested in the many shapes that can take, therapy being just one of them.
Hmm.
I started practicing yoga at 17 and learned breath work, pranayama at 17.
Hmm.
And so these seeds started to get planted all
Nice.
around the same time in my life, which was really interesting. And so that sort of snowballed. It led to, one psychology class after
Hmm.
another,
I can
going down
imagine.
that road. Yeah. And then on the personal side of things, evolved into, a yoga practice, into breath work, into different movement practices. And then, just as it goes in the wellness world, once you get exposed to one thing, that usually leads to learning about something else. And it sort of has taken on many shapes and expressions over time.
Yeah. No, that sounds like it was just where you were meant to be. I mean, that it just everything kind of came together at the same time. It seems like.
It did.
So when it came to schooling and things like that, what was the journey like professionally, like getting through that whole process? I mean, considering you were also, it seems like you were dealing with a lot of these issues while you were in school, learning about a lot of these things. So.
Yeah, I look back sometimes and I'm really astounded by how I was able to get through college, especially undergrad, because I really was struggling so much in my personal life. But I think I became sort of a student of my own process really early on.
Hmm.
So I was always, from a really early point in my schooling and my training, kind of aware of how the personal becomes the professional. How the personal opens up so many insights about wellness is and what it can look like for other people and what people's challenges are and, you know, how people experience this kind of stuff. So I was always kind of drawing information from my own process at the same time that I was going through my process, and at the same
Yeah.
time that I was learning about
Mm-hmm.
it in a more like sort of general and objective sense. So for the early years, it kind of, you know, it kind of happened like that. You know, I was going through school, I was pursuing this, you know, this track, doing a lot of research. So for the first several years of my training through my undergraduate and my master's programs, I was involved in a lot of psychology research, which was really great. And then at the same time, kind of like I said, being a student of my own process
Uh-huh.
and learning, and sort of this feedback loop of applying things that I was learning in my life and feeding that back, etc. And so it always kind of happened like that. You know, there were these sort of two parallel threads. For sure, you know, I stabilized in college, and I developed a really sort of healthy relationship with myself and learned how to manage my anxiety in more adaptive
Mm-hmm.
ways, really thanks to all of the practices and modalities that I got exposed to. And so, you know, that sort of sense of integration really helped me personally, but I think also gave me that fortitude to keep going with my schooling.
Mm-hmm.
And so yeah, so I did my undergraduate degree. I graduated in 3 years, and then decided to go work in the restaurant world. Interesting. I kind of like walked away from all of it and worked in restaurants for a couple of years, and through actually after a couple of years of being in that industry, realized how much I was taking a psychology approach to all of it and using that lens. So I said I might as well go back.
Yeah. Yeah, no, I mean, it seems like you were talking, all the different facets and all the different things that were coming together. It must have been quite a profound learning experience to experience it while you were actually learning about it. So it seems like there were several, but what would you say is the most significant challenge you had to overcome while you were on this journey, through going through into school and things like that?
I think the biggest challenge was my shadow,
Mm-hmm.
to tell you the truth. There are these sort of dual competing forces inside of me that now I feel like I said, are more integrated and more settled within me. But there were several years where I was being pulled in two different directions. There was the direction of my professional life and my, you know, sort of mindful way of being in the world,
Uh-huh.
and then there was this other element that was sort of pulling me in this really different, subversive kind of direction.
Mm-hmm.
I did a lot of acting out. I was a party girl when I was younger, kind of reckless for periods of my life. And so finding a way to harmonize
Mm-hmm.
those energies inside of me, which is really, you know, the Taoist philosophy has helped me so much in that respect, to
Mm-hmm.
find a place for the shadow, to find a place for these different energies so that they don't feel like they're competing with each other, but rather coexisting with each other.
Mm-hmm.
That was a big challenge, but one that I feel, you know, is pretty settled at this point.
Yeah, no, which is great. I mean, I think it's important. I think a lot of people, and you know this better than me, just from my personal experience, I think a lot of people try and stray away from the shadow and just focus on the light, which I think for the most part that's probably a good way to live life. But it's also really important for us to acknowledge the shadow,
Yeah,
because you don't know the difference between the light and the shadow unless you acknowledge both of them.
absolutely.
So, um, so what exactly do you think that was the most profound lesson that you learned from that, from your shadow,
Oh, from my shadow.
or that shadow work, I guess?
Yeah. I think the most profound lesson was how to be with my pain, how to alchemize that in ways that are productive. You know, understanding what the shadow was about, understanding what, you know, that duality was really comprised of and made up of, and then understanding how to be with myself through all of that, because that has translated into so many different things in my life, and that also translates into awarenesses and perspectives that really serve me when I'm working with other people
Mm-hmm.
as well. So I think that was the biggest lesson, and that came, you know, a lot through meditation, actually, and a lot through mindfulness practice, that lesson and that insight and awareness
Yeah.
of how to be with that. It's one thing to say, oh, I'm doing shadow work, or, oh, I'm integrated, or, oh, I understand what is shadow and what is light. But it's another thing to actually, be under the influence of those, dual forces, and to understand how to flow with that, how to be present to all of that.
Yeah. I definitely think that's an important. What would you say is your approach with people? I mean, how do you open people's minds to even grasping that concept that there's a duality within them, that there is like a light and a dark side?
I mean, there are lots of different ways that comes about in the work. I think one of the sort of, to be reductive about it, approaches that I take is utilization. It's, bringing the light of awareness to everything that shows up in the process, and helping people to be aware of those parts of themselves that they are inclined to disown, that maybe they don't even recognize that they're doing it. So language is so revealing in that way. Where somebody will be presenting something and it becomes evident, in the course of that there are parts of themselves that they're suppressing, that they're denying, that they are, trying to exclude from their experience. And perhaps they're suffering as a result of that, or they're feeling limited or constrained as a result of that, or misaligned as a result of that. And so really shining the light of awareness on all of the parts of each person that I work with, and helping them to integrate those parts by utilizing them, by finding out, getting curious. What is this part of you? What is this part of you revealing to you about perhaps what you need, about perhaps what you desire, about, perhaps what is living inside of you? And then how can those things be utilized, and how can those things be worked with, so that you feel yourself as an integrated whole, rather than as this sort of set of disparate parts that don't work together.
Yeah, because it's all a part of a whole, right? So
yeah, exactly.
So what would you say is one of the most common issues that you find with people that come in to see you?
Anxiety is a big one. I personally believe that, like, the whole Diagnostic and Statistical Manual of Disorders, we call it the DSM, all of the mental health disorders, I think, are their own variants of anxiety. I think, being in the world naturally produces a certain degree of anxiety. We're in this big existential swirl, and it's a pretty groundless experience to be alive if we're really present to it. And so that produces certain degrees of anxiety, not clinical anxiety in the way that we think about it. So not everybody who I work with presents with a certain set of symptoms that we recognize as anxiety, but some degree of that sort of existential anxiety, whether that is dissatisfaction with the course of their life, whether that is sense of alienation or conflict inside of a relationship, things that just aren't working, and all the reactivity surrounding that, whether it's being presented with life transitions and being challenged in that, whether that's kids who are aging, or themselves who are aging, or finding themselves in a different part of their lives than they anticipated, and the reaction to all of that, the sort of anxious response, that's pretty consistent across everybody that I work with. So if we were to look in more sort of basic terms, I would say, relationship issues show up a lot. Those transitional issues show up a lot. Grief, and essential, like, dissatisfaction in the many forms that takes, whether that's depression or low self-esteem, or a feeling of disillusionment with, their job or their relationship, or whatever the case might be. Those are the hallmarks.
Yeah. So it sounds like it's not necessarily something that's like a clinically diagnosed anxiety disorder. It's just everybody, or I don't want to say everybody, but most people probably have some level of low-lying anxiety, and probably I would imagine, due to what you were saying before, like with that shadow work, where people just suppress a lot of emotions or memories or situations, and when you don't acknowledge those things, it's going to manifest somehow.
Exactly.
So.
Exactly. And we live in a culture and a context that encourages suppression, not overtly, but
I
in
know.
so many ways, the world we live in. So
Yeah.
this stuff starts to bubble up in people in so many ways.
So, I mean, what's an easy way someone can can handle that. I mean, obviously, speaking with you would be helpful. But if somebody is at home and just something that they can do daily to help relieve that kind of anxiety, low level, like a dull anxiety.
You know, there are a few things. One is any practice that heightened self-awareness is going to be a good practice with respect to managing anxiety, because it's going to open up the range of possibilities for how to manage that. You can't manage it if you don't know what it is. You can't do anything about it if you can't see it. So to open up the lens and broaden the perspective of, you know, what you're experiencing, what's showing up, where is it resonating in the body, you know, those things become very useful. And there are a lot of ways to practice that. You know, journaling is one, reading is another, and reading anything really. You know, reading gives us this opportunity to be identified, you know, in ways that aren't confronting us, you know, so directly, but that stimulate some thoughts and some perspectives. So journaling, reading, meditating for sure. You know, body work, anything that allows connection in the body, whether that's, you know, yoga, whether that's dance, whether that's, you know, massage, acupuncture, bridging that, you know, that gap between what's happening up here and what's happening from the neck down, right? So often we only live up here, and so we lack awareness of what's going on in the body. And those, you know, those cues from the body are so important. They're such big indicators of what we're actually experiencing. That then gives us, you know, the opportunity to be with that, you know, in ways that can be healing. So I always tell people those are the preliminary sort of basic practices that can help to expand that self-awareness, and that can be the beginning points of providing some of that relief. And yeah, of course, talking with a professional is really helpful, because as human beings, we make sense of things through language. You know, we need to give voice to things to really understand them.
Absolutely. And Seema asked, do you use EFT?
Well, there's two EFTs. So there's the emotional freedom technique, the tapping. I don't know if you're referring to that one, or EFT, the couples therapy approach, emotionally focused. I don't use either. I'm familiar with both, but I'm not sure which one Seema is referring to.
All right. Maybe she can
Yeah.
throw in another question there. We can get to it.
No.
But what it seems like, so this low level anxiety, I mean, especially now that people are going to start going back to work and things like that. And I feel a lot of people get anxious at work, or that low level anxiety that's kind of built up over time, because people just kind of like brush things under the rug, and then there comes to a point where there's no more room under the rug. So how would you say that either somebody, whether at work or if they're in one of those acute situations where, I mean, it's just very tense, and they don't want to blow up, for lack of a better term, what's something you think that they could do in those moments to really help kind of tone themselves down?
Well, you know, that's a tricky question, because there is a sort of critical tipping point that we all get to, right? That we all go through this sort of range. If we thought about it as a scale from 0 to 10, where 10 is like that full emotional override, where it's either explosion or implosion or shutdown, you know, whatever our manifestation of that extreme point is. You know, once we start getting into the like 7, 8, 9, 10 range, we're not going to be able to access our highest self and like grasp those tools. So the thing I always tell everybody is understand what you experience, and really get curious and spend some time understanding your own process enough so that you can start to recognize what your 0 looks and feels like, what your 2 looks and feels like, what your 5 looks and feels like, so that you can be more present to yourself along the way as you move across that continuum, so that you can manage to be responsive rather than getting to that full reactivity place. And so things that help with that mindfulness practice, I mean, it always kind of comes back to mindfulness, because mindfulness is really, of course, self-awareness, right?
You took the words out of my mouth. I was going to say, it's really just self-awareness. So realizing when you're reaching those points. And I mean, I can speak for myself personally. I think once you get to a point in your self-practice, you start to create boundaries. And when you have those boundaries, I mean, you're going to voice out your feelings. There's not, and I think that's, like you said, it's like people are supposed to throw things under the rug or push things down and suppress them. But I think it's really important that we voice our feelings. I mean, in a mature, harmonious way, obviously, but I think to express ourselves is really important, and will prevent a lot of those buildups and explosions. And like I said, creating boundaries for yourself, so you can either teach people what your boundaries are, or just remove yourself from a situation entirely.
Yeah, yeah. And to do any of that, you've got to be centered, right, to a certain extent, so that that can be done in a thoughtful, deliberate, intentional, responsive way rather than a reactive way.
Mm-hmm.
That could have collateral damage, that could have some negative consequences, so managing oneself to stay in that sort of equilibrium is really important, so that then all those options are available, like you said, like setting boundaries, articulating needs,
Mm-hmm.
Prioritizing tasks so that it doesn't always feel overwhelming. We live in a really pressured state a lot of the time.
Mm-hmm.
Our life in this, in this context in our culture is very go, go, go. It's very pressured, and this sense of urgency, and it produces a lot of stress. It produces a lot of anxiety. It activates the nervous system. And once we're in that state, everything feels like an emergency.
Mm-hmm.
Everything feels like it has to happen right now.
Yeah.
And that scrambles the brain waves, and it keeps us from having that clarity of, pace and priorities, and, that understanding of how we can navigate those things in such a way that we can still be well and not reach that 10 point and not get explosive. So it all really starts with the self-awareness piece, and then that, that centering that helps us to be as intentional and thoughtful as possible.
Yeah. So I mean, it's one of the things that I like to, how I like to put it is that managing your internal environment and not allowing the external environment to manage that for you.
Yeah, because if you don't manage it internally, it will get managed.
Yeah, exactly. So one of the other questions on there is actually kind of a very similar question. What do you love most about your profession? I was going to ask you, in the work that you do, what are the moments that bring you the most fulfillment and joy? So those are kind of the same.
Yeah. So many. I feel like the most fortunate person in the world to do this work. I really do. I feel so privileged. I feel so fortunate to be able to work with people in this way. For me, every part of the work, and I mean this sincerely, I'm not trying to be cheesy, but for me, every part of the work is fulfilling, because it's a privilege to have intimacy with another human being. We don't have a lot of intimacy in our lives, true intimacy, and I'm sure you've heard this before, intimacy being said as into me you see.
Oh, yeah.
And that's really, what it's about. And so just that opportunity to sit across from another human being and be inside the swirl together, to just be sharing this human experience with each other in such a vulnerable way, in such a stripped down, exposed and open-hearted way, that's truly fulfilling for me. And then, as far as outcomes go, seeing my clients not only sort of have those moments of insight, have those awarenesses, start to experience differences, start to experience change and transformation in their lives, and getting to witness that growth process, that's incredible. And that's, wholly fulfilling. And then hearing from people, people that I haven't talked to in a couple of years, seeing people who have, in fact, the client I worked with this morning, I met, in a treatment center when he was, at the very early stages of battling addiction. Now he's many years, clean.
That's
and
amazing.
Living a beautiful, life, a balanced life, a mindful life, and getting to, hear all of the ways that he has taken on his own process and become his own sort of, his own guru, his own teacher.
That's beautiful.
Incredible. It's such a gift.
Great. We had another comment. Oh, self-awareness and accountability create boundaries. Yes, absolutely. Yes. All right, so I'm going to shift gears or transition a little bit into, well, we already touched on it a little bit, mindfulness. How would you describe the ways in which you incorporate mindfulness into your life daily?
Well, so I incorporate formal practices, meditation being one of them. I have a meditation practice, a steady practice that, is my, return to to awareness and return to mindfulness so that I can cultivate it and bring it with me every life. I have a journaling practice. I have a movement practice. So my practices are really the mainstays of, of my mindfulness and how I incorporate it in my life. And connection with the breath is a big one for me. Understanding my triggers for reactivity, understanding my process, understanding the ways in which I get activated, and how that activation disconnects me from my experience, and really practicing finding those entry points to mindfulness when I'm hooked, when I'm activated, when I become reactive, and then using my breath to bring me back into my body, to bring me back into the moment. So, mindfulness is it's such a beautiful practice because it's not about the staying in one place all the time. It's about the coming back to that place when you drift away. It's when you disconnect from the moment, when the mind takes over, when the time traveling happens, when the reactivity builds up, catching it, and then realizing here's an opportunity for me to, take the wave of my next breath and get back into my center.
Yeah, absolutely.
So yeah, and it's a challenge every day, right? It's
it's
not that
a
I'm
practice.
near mastery. Yeah, I'm in the practice of it all the time.
Yeah, and like you said, I think one of the biggest barriers that people have to meditation is that they think they're supposed to be in this state of no mind, constant state of no mind, and it's just that's not going to happen. You're not going to turn off your brain. And I think
call 911.
Yeah, right. I think that the just simple awareness of where your mind is and being able to bring it back to center is what meditation is all about.
Totally. It's becoming a witness to your mind as much as possible and moving back into that witnessing stance so that you can see what your mind is up to.
Exactly. The witness, yes.
Yeah.
Perfect. So how would you say, what's a couple ways that you incorporate it into your practice, mindfulness?
So a big part of it, I used to teach and present on this topic a lot, several years ago, about the personal process of the therapist. The work of a therapist is so hinged on that person's ability to be present in the experience. So I think about my work as a meditation. I think about therapy as a drawn out meditation. I am meditating on my client, for the course of the session. And so I feel like I log a lot of meditation hours daily because of the work that I get to do, because, it's a practice of being in my own body first and foremost, and understanding what's happening in my body, because my body's always giving me information. Our bodies are always giving us information. And so connecting with myself is a way, that the practice extends into my work with clients, being embodied, being present to what I'm experiencing, and allowing that to inform my exchange with my clients. And then trying to bring that centered, open awareness to the process, and recognizing when I'm going into my own stories, right? My own interpretations of what's happening. As soon as I believe that I'm right, I'm wrong. As soon as I believe that I have some ideas about what's happening, that's how I know I'm in trouble. Because I've lost curiosity, and then I've lost presence, and then I've lost my client. Now I'm no longer connected to their experience. I'm connected to my own story about that experience, and so coming back to what's unfolding in front of me in this moment, and to receive that with open awareness and curiosity becomes really the practice. So it really takes the shape of meditation.
Yeah, I mean, the constant curiosity, or the constant questioning more and more, and like you said, not going into your own story. I think that's beautiful, actually. I think I'm going to somehow try and work that into my own practice.
Nice.
So outside of your practice, what's been your experience with, and do you feel that mindfulness is being practiced readily in the health and wellness industry field?
So I just want to make sure I understand. Is mindfulness being practiced in the health?
What's been your experience, and have you witnessed or heard of other mindful practices being utilized in health and wellness?
Yeah, more increasingly more so, thankfully.
Mm-hmm.
Like we talked about on our call the other day, when I first started to incorporate mindfulness and meditation and Buddhist thought and Buddhist philosophy into my work as a therapist, I didn't really have too many people to learn from.
Mm-hmm.
And I thought for a long time, it was sort of these two separate lanes. Like there was my wellness practice and my mindfulness practice, and then there was my work,
Mm-hmm.
which seemed like totally devoid of that. And so it seemed like it had to be these two things that run parallel but never intersect.
Mm-hmm.
But over time, I'm starting to see, in the profession of therapy and psychology, my goodness, there's a mindfulness revolution happening.
Which is
And
wonderful.
it's wonderful. It's sometimes it cracks me up, that the field of psychology is almost like acting like they invented this
Yeah.
stuff. It's like it's been around for thousands of years,
Yeah,
but all
exactly.
right.
We'll let you
Here's
say you
what.
did the studies and discovered all these things. So
Yeah, yeah. So it's happening more and more, which is beautiful. In whatever form it comes, it's beautiful. And
yeah.
and so yeah, it has been a revolution. And over the course of the many years since I've been studying and practicing and all that stuff, I've seen it come more and more into the fold. Mindfulness and wellness and holistic health and an understanding
Mm-hmm.
of what that means. That actually was why I pursued my PhD in marriage and family therapy as opposed to staying on the psychology track, because the field of marriage and family therapy actually evolved in the 60s as a reaction to the field of psychology, which the originators of it felt that psychology was way too linear, it was way too intrapsychic, it was way too much about the mind and the
Mm-hmm.
individual, sort of devoid of all of these other influences and the context in which life is happening. And so so I was so gratified that this existed.
Mm-hmm.
And in that field there is more awareness of wellness and holistic health,
Yeah.
and even though it may not be talked about explicitly or directly,
Mm-hmm.
mindfulness is in there
Oh
somewhere, and
yeah,
it's
for sure.
becoming more.
Like you said, I think I think that's how medicine started, or whatever you want to call medicine. I mean that it was mindful practices and a holistic approach. I think we've kind of have this view on what holistic means, and that it's not real medicine. But I mean that's what how medicine began, in my opinion, in my understanding, and then we kind of broke it down and made it very unilateral to specific fields. And like you said, just psychology, just focusing on the brain, what's going on in the brain, chemical this, chemical that, and this plus this equals that. When it's very multifactor, I mean, you have to take into whether it's dentistry, functional medicine, or mental health. I mean, you have to look at the overall person. I mean, we are not just very like I said, unilateral beings. I mean, there's a lot of things that go into our lives, and I think that's very important when it comes to healing in general, whatever
Totally.
the ailment is.
Yeah, it's amazing how we've moved so far away from the things that actually heal. And I think there's two reasons for that. One is I think if you are going to take a mindful, holistic, integrated approach, you have to allow yourself to delve into the realm of not knowing. And I think as health practitioners, we don't like that space.
Exactly.
We like things to be exact, and we like to feel like we like
No.
to feel competent,
Yeah.
and we like to feel like we can be helpful. And sometimes it's about sort of being in that not knowing, and being in that big open space,
Mm-hmm.
of what it is to be human,
Mm-hmm.
of the experience of being alive. And I think that is avoided very much
Mm-hmm.
in our professions. And I think it touches the spiritual a little bit too much for our sort of litigious society.
Mm-hmm.
And so there's this fear of offending people, there's this fear of alienating people, there's this fear of saying or doing the wrong thing and being sued,
Yep.
and all that kind of stuff. So it's understandable how it evolved this way, but I think it's just taken us so far away
Mm-hmm.
from what healing actually is.
Yeah, it seems as though there's some sort of expectation of on ourselves, of course, which to a degree I think is okay. But I think society and patients and the medical paradigm of today has some sort of expectation where, I mean, you go to a doctor and they're supposed to know everything. And I mean, it's a practice. We're all learning, and I think working together to learn. I mean, being with somebody or going to somebody, and whether it's a therapist or whatever another kind of procedure, I think it's really important that we are open-minded and stay open-minded to all the different possibilities of what's actually going on.
Mm-hmm. Yep.
So,
Absolutely.
um,
That was beautiful what Seema said, to be human and very much connected with each other.
yes. Oh, I didn't see that. Yes, that is beautiful, actually. Yeah, because we are.
Very
um,
so.
so, what are some of the greatest benefits you've either or experienced and then also witnessed from these mindful practices?
Goodness. I mean, self-awareness is big, because what self-awareness then affords us is more alignment, understanding who we are and living life in accordance with that, so that there is that alignment, so that there is that, that sort of harmony. And whenever we're in that space, we are more fulfilled.
Mm-hmm.
Life feels more meaningful. Life feels more satisfying. So that self-awareness that breeds integrity, that breeds authenticity, that breeds, alignment. That's a huge benefit. I think that one is already worth the price of admission.
Yeah,
um, More connection is
absolutely.
another benefit. To be present to experiences, allows us to feel more connected to
Mm-hmm.
those experiences and to the people that we're sharing that experience with. So that attunement to other people, that attunement to our surroundings, is a big benefit.
Mm-hmm.
And then, that inward awareness, that inward focus, that, is not just mind, but also body,
Mm-hmm.
and also heart. The benefits of that are like limitless,
Mm-hmm.
and that then lends to more physical health. If
Yeah.
you are present to what you're experiencing when you eat food that is alive versus food that is manufactured and processed,
Mm-hmm.
you can feel that you're going to be more inclined to choose the things that feel good.
Mm-hmm.
But if you're not present to any of that, then if you're numb to all of that, which is really the way we're conditioned to live,
Yeah.
honestly, that is sort of the default setting, is sort of unaware and disconnected. And the mind plays a big role in that, because the mind is so noisy that it takes us away from, our presence to other things we're experiencing.
Mm-hmm.
But when we can really connect and root down in that, then we have more of a sense of what wellness actually is for us, and we start to move in the direction of that,
Mm-hmm.
and that opens up its own host of benefits.
Yeah, absolutely. I like you said, I think we're conditioned to look externally for everything. I mean, because there's so much, right? I mean, around us, there's so much going on in our lives. There's so much going on in the world and the universe. But I think what we need to understand is that connection. That if we go within, it's actually deeper. I mean, we can go deeper within because it's all connected. It's all the same thing. And once you understand that everything is connected, you don't have to think about all the vastness going on and drive your mind crazy when you can just go in and feel that oneness within yourself.
Yes, yes, yes,
Awesome.
absolutely.
Awesome. Awesome.
Understanding that you're the filter of everything that you
Mm-hmm.
experience. Everything is always reflecting you back. It's
Yeah.
always about how you're interpreting. It's always about the meaning your mind is creating. It's always about how you're receiving. I always encourage people to think about life as neutral. Think about everything around you as neutral. Because if you think about it if you see it as neutral, then that gives you so much richness to play with in terms of how you're experiencing it, and that keeps leading you back to you. That keeps leading you inward, inward.
Mm-hmm.
And then the work is like endless, and
Yeah.
it's so rich and meaningful to be looking at what is my filter, and how can I make room for this experience in a different sort of way? How can I be present to this in a different sort of way?
Yeah. Absolutely. And it's you just described it really well. Actually, I was gonna say it's hard to describe what that inner feeling is. But when you describe like Seema said, you are the filter. I mean that's beautiful. And because it is neutral and you can give positive or negative note to it. Yeah. So I want to shift a little bit to go deeper into your expertise. So in the mental health space, what would you say is your expertise in that?
Oh, good question. So my expertise is twofold. One is population wise. So I specialize in working, I work with a broad range of people in my practice, but exclusively specializing in working with the LGBTQ community,
Mm-hmm.
which is interesting. So that comprises about probably 60 to 70% of my practice are people
Mm-hmm.
who identify as LGBT. So I have received and given, special training over the years and working, with this population and with the experiences of identifying as such in our culture and in our context. So that is, I'm sort of recognized as working with that population in terms
Nice.
of, specialization. And then in terms of the work, it's really that incorporation of the mindfulness aspects and also the spiritual aspects, however people define that. That's really central to my work. I think it shows, people who check out my website get a pretty clear sense of that being part of the work. And that's not, that's sort of not how we're trained as traditional Western psychotherapists. So in that way, that becomes its own sort of specialization and expertise. And then I do have a relational focus. So I am an expert, if you want to think of it that way, at helping people understand things in relational terms, understanding people's relationships to themselves, to their own core values, to their own beliefs, to their own sense of the meaning of life, as well as their relationship to their actual lives and the people in their lives.
Very nice. And I know you said you had some mentors that were Buddhist teachers, and also you studied Taoism, and I think you said you had a mentor that was a Taoist, right? So
Yes.
what are those for people that may not be too familiar with it?
Well, so Buddhism it's both a philosophy and a religion. I mean, we could spend hours and hours
Yeah.
talking about what Buddhism is, but distilled down to its basic parts in terms of how it helps us today and how we can incorporate it and integrate it. It's really a path of releasing attachment as a way of reducing suffering and increasing fulfillment and presence to one's life. If we wanted to get really, really, really reductive about it.
Yeah.
And Taoism is a rich philosophy and ancient, thousands of years old Eastern tradition. And if we wanted to distill that down to its basic parts, it's really a practice that teaches us how to flow with nature, how to connect with our own nature, how to connect with the natural order of things through practices and principles like simplicity, like patience, like harmony, like balance, and like compassion.
Yeah.
And Buddhism is very much centered on compassion as well, depending on the particular tradition that you practice.
Those are very great descriptions of it. I mean, I've heard a lot of people try and describe what these things are, and like you said, obviously it's a humongously broad topic. But I like how you describe it, because I think a lot of people, especially when they hear Buddhism, they think of it as a religion, and that's another big word today. But it's not just you can practice Buddhism without religiously being Buddhist.
Yes.
So
yes.
I think that's really important for people to understand.
Totally. I think about Buddhism as the original psychology, and so if you'd be open to exploring psychology, and there would be no compunctions about that, then Buddhism could lend itself to the similar kind of teaching.
So what are some maybe a little bit more specific or teachings that you utilize when treating patients or treating clients?
The idea of harmony is a big one. And the idea of acceptance and non-attachment is another big one. That those end up taking a lot of different forms, because the inverse of that shows up so much in therapy. We think so much in these like either or terms, and we do sort of separate ourselves into these parts rather than thinking of ourselves as an integrated whole. And so finding room for everything to fit, just like nature does, nature contains everything without issue, and everything performs its part, and everything belongs and everything fits, in the integrated whole that contains all of it. And so we are a microcosm of nature. We are nature. So how to do that within ourselves, because if we can hold space for everything that fits, that exists rather inside of our own experience, and we allow it all to fit inside of that container, then we are much more at peace. Than if there are parts of ourselves that we don't know how to be with, and we need to stuff them down and suppress them or deny them or try to do away with them or try to numb them. or try to distract ourselves from them. That creates a lot of disequilibrium, that creates disease, right, within ourselves. We're not at ease in our own experience. So creating that harmony, that balance that allows for everything, is a big one. And the non-attachment one is huge. We do, the Buddhists are right. We suffer so much because of our attachment, because everything is impermanent. Every emotion, every experience, every relationship, every life. And it's the most painful part of our existence. And it's also the most inescapable part of our existence.
Yeah,
So
it's a huge part of our conditioning, especially in Western culture. I mean, no matter kind of really whatever you do, anything you watch on TV, I mean, it's kind of conditioning you to have that mindset. And there's always drama and always hysteria, and I think that's beautiful.
yeah, the willingness to let go serves us so much more, so much more. And when we do that, we find out we need a lot less than we think we did. And when we do that, it brings us back to ourselves. And it, I mean, not to sound, macabre, but it prepares us for death.
Yeah.
And our unwillingness to accept the reality of our mortality is at the root of so many of our issues. And in so many ways, we avoid death, whether that's the death of a relationship, whether that's the death of an experience or something that was once serving us but isn't anymore. The willingness to die over and over and over again. That's what non-attachment practice is really all about. And that in its own way teaches us how to live, with peace and without so much suffering and anguish.
Yeah, absolutely. I think that, like you said, the lack of attachment, and those different stages that we go through in our lives, you can kind of, every time you overcome something, it's almost like a death of some sort, and each lesson is kind of preparing you as you move forward in life for just another death. It's just another learning experience, essentially.
Yeah.
So.
Yep. And if we're willing to die, then we're able to live more deeply. If we
Exactly.
acknowledge that as the reality, then we can be more present, and actually be here for life. If we're not hustling so much to deny or avoid that, then we can actually be here for the journey.
Yeah, exactly. Exactly. Okay, so we have a few minutes left. So in closing, we touched on this a little bit, but I want to get really specific. If you could only share 3 things that people could start implementing in their lives immediately to improve their overall mental health and awareness and release of attachment, what would they be?
Meditate. Meditate. Figure out what you value. Figure out your blueprint. Understand what matters to you. Understand what you most value. Understand what gives you the most meaning and fulfillment in your life, so that can be your due north, and you can orient your life accordingly, and so that you can live in a way that's in integrity and authentic, and you can experience fulfilling connections that support and are in alignment with those things. And number 3, be good to your body. Be good to your body.
You only got one, right?
You only have one, and everything, the mind-body duality thing is so silly. It's all one thing, and all the energy runs along one channel. So learn how to breathe, learn breathing techniques, how to really get a proper breath, and how to, really feel alive through the breath, how to really feel alive through food, how to really feel alive through the way that you connect and give to your body, and learn how to listen to your body so that you can get into a deeper relationship with it. Life will transform invariably when you do that.
Absolutely. That's beautiful. I love those 3. I'm making sure I write them down. But speaking of, on one way or another, I do practice these things. Speaking of meditation, are you still holding weekly or daily meditations on Instagram, right?
Yep.
Okay.
So it was daily. Now we've been doing 3 days a week. So Monday, Wednesday, Friday, 3:30 p.m. Eastern Standard Time. I'm doing a guided meditation.
Nice.
It's usually about 15 to 20 minutes, a nice midday kind of break.
Yeah.
So I'm doing those on Instagram Live. I also have an archive of those. So if anybody wants those, they can reach out to me directly, and I'll send a link for all the previous meditations that we've done. There's probably about 30 of them in there.
Awesome. Awesome. Yeah, I've jumped in on a couple of them and very good. I was very pleased afterwards. So.
Awesome.
So I just wanted to give a quick recap of your business and where you're located, best ways to get in touch with you, social media, all that kind of stuff.
Awesome. So social media, I'm at Dr. Denise Fournier. You can connect with me here on Instagram. I'm most active on Instagram, so that's the best way to keep up with me. My website is evergreen-therapy.com. So www.evergreen-therapy.com. That's the best way to connect directly with me. You can connect through phone, through email, or through the contact form in the website. That'll lead you directly to me. My practice is normally in Miami. Oh, bye, Cheryl. You know, my practice is in Miami, so typically, that's where I see clients. But of course, right now I'm working virtually, and I expect to continue to work virtually for some time. So,
Great.
Yeah, so that's available as well.
Yes, thank you, Seema. I think this was fantastic as well. I appreciate you coming in here.
Thank you.
And you're welcome, Hal. Of course. So my one last question. What is your personal and heartfelt meaning of mindfulness?
Ah, wow. That's a beautiful question. My personal and heartfelt meaning of mindfulness. Being here for life as it's happening.
Great.
Yeah.
Beautiful. All right. Well, thank you very much, Dr. Denise Fournier, everybody. I really appreciate you coming on here. For everybody that's watching, thank you for being here. I welcome all comments, feedback, suggestions. If you guys want to hear from somebody that's already been on, especially Dr. Fournier, if you want to have her back on, or if you have any specific questions, or if any ideas of other people you want me to bring onto the show, definitely let me know. You can check out all the previous episodes on my YouTube channel called The Art of Mindful Medicine. And my website is www.mindful.doctor. And again, we're here on Instagram Live Saturdays at 12. And like always, I end with a quote. This was so perfect for what we were talking about too, because it was the quote was by Buddha, and it is better to travel well than to arrive. So I think that, I think that's a great way to sum this one up. I appreciate you being here. Thank you very much. And again, thank you everybody for watching. Really appreciate it. Hope everybody has a fantastic weekend. And always, stay awesome and stay mindful.
Yes. Thank you so much, Seth. Thank you, everybody.
Have a great weekend, guys.